Welcome to today's video. Are you pregnant or trying to conceive? Have you experienced unusual bleeding and wondering whether it's a sign of pregnancy or the start of your menstrual period? Don't worry, you are not alone. In this video, we will guide you on how to distinguish implantation bleeding from menstrual bleeding. Implantation bleeding is a common occurrence during early pregnancy. It happens when a fertilized egg attaches to the lining of the uterus. Here are the things you need to know about implantation bleeding. Appearance and characteristics of implantation bleeding. Implantation bleeding can vary in color and appearance, but it is generally lighter and shorter in duration than a typical menstrual period. The blood may appear as light spotting or a few drops of blood that mix with cervical mucus. Implantation bleeding may be pink, brown, or light red in color, and is usually accompanied by mild cramping. Timing of implantation bleeding. Implantation bleeding usually occurs about 10 to 14 days after conception, which is about the same time as a woman's expected period. However, the timing of implantation bleeding can vary slightly from woman to woman. Some women may experience it a few days earlier or later than the average time frame. It is important to note that not all women will experience implantation bleeding, and it is not a reliable indicator of pregnancy. Do all women experience implantation bleeding? No, not every woman experiences implantation bleeding during early pregnancy. It is estimated that about 30 to 40% of women will experience this type of bleeding, while the majority will not. The absence of implantation bleeding does not necessarily indicate that a woman is not pregnant. Some women may experience other early pregnancy symptoms, while others may not have any symptoms at all. Duration of implantation bleeding. Implantation bleeding is usually shorter in duration than a typical menstrual period. It may last for a few hours to a few days. While implantation bleeding is generally considered normal and nothing to worry about, it is important to monitor the amount and frequency of bleeding. If the bleeding becomes heavy or is accompanied by severe cramping, it is important to contact your healthcare provider as soon as possible. Differences between implantation bleeding and menstrual bleeding. Implantation bleeding is often mistaken for a light period, but there are some differences. Implantation bleeding is usually lighter in color and lasts for a shorter time than menstrual bleeding. Menstrual bleeding is usually heavier, lasts longer, and is accompanied by more severe cramping than implantation bleeding. Implantation bleeding can be confusing and stressful, especially when you're trying to conceive. But remember, it's a natural occurrence that happens during the early stages of pregnancy. If you suspect that you may be pregnant and experience unusual bleeding, it's important to stay calm and seek medical advice. Your healthcare provider can perform tests to confirm that everything is progressing normally and provide guidance on what to expect during early pregnancy. They can also offer resources for a healthy pregnancy, including prenatal care and advice on lifestyle changes. It's important to remember that implantation bleeding is just one possible sign of early pregnancy, and not all women will experience it. Other early signs of pregnancy may include fatigue, nausea, breast tenderness, and missed periods. If you're experiencing any unusual symptoms or have concerns about your pregnancy, don't hesitate to reach out to your healthcare provider. They're there to support you and your growing baby every step of the way. In summary, implantation bleeding is a common occurrence during early pregnancy caused by the fertilized egg attaching to the uterine lining. It's usually lighter in color and shorter in duration than menstrual bleeding, and may be accompanied by mild cramping. Not all women will experience implantation bleeding, but if you do, it's important to monitor the amount and frequency of bleeding and seek medical attention if necessary. We hope that this video has provided helpful information and guidance on understanding implantation bleeding and its differences from menstrual bleeding. Thank you for watching. Like, comment, and subscribe.